I think the hardest part about career transition is actually moving, right? Like medicine, more than probably anything, has a great deal of inertia because transitions in medicine are hard for logistics reasons, right? Like it's hard to move, it's hard to change practices, re-credential, et cetera, et cetera. I kind of went through a situation where I was being coached through this exact thing. I found myself in a position of great dissatisfaction with my career, and I was just trying to figure out how to get to a place of more fulfillment, but I also felt very stuck in my situation. And having a coach there really helped me, first of all, identify what was missing so that I can identify what I was trying to transition to. And then she helped me develop a plan to actually make that change. So I think the benefit of coaching in this situation is, one, they provide clarity because of their emotional separation from the issue. And then the second is that they provide accountability for you to actually make a plan and do it. Because the path of least resistance in medicine is really just to stay where you are, right? Like, but actually making a plan, executing a plan to make the transition can sometimes be hard to do on your own. And for me, having a coach help me through that was very, very helpful.
Yeah, sorry, did I?
No, go ahead, Jeff, please.
So adding to that, for me, when I look back on it, it was a career transition, but I don't know that I recognized it, right? So really kind of dated back to me getting into coaching in the first place. And so what I was doing was I was in the clinical practice that felt like working 120%, 130% of the time. And the coaching ended up being a way to integrate coaching into my career as a potential exit strategy or a side interest. And so it allowed me to, rather than doing something drastic, like I'm going to just change completely in my career or go into retirement or change jobs or change my clinical focus, it was not as thought out as this is what I was going through. And I see that a lot in coaching where people are looking for something, they're not sure what it is, but it is some sort of change or transition. And so in hindsight, it allowed me to get my practice from a transition of overworking to a little bit more, I'm now working 100% of the time instead of a lot of overtime. And then over time, that's helped me evolve from a 100% clinical practice into one that is approximately an 80% clinical practice to that and 20% coaching. And I still have a longer term goal of it being much closer to 50-50. And so I'm still using coaching as a career transition.
I think this one for me, being a younger physician, haven't been in practice, been in practice for almost 5 years. This is a great example of something we touched on earlier, where your coach doesn't have to be necessarily an expert in a particular area to coach you. So I think this just highlights one of the strengths of coaching and those that undergo coach training and pick up some of the skills, but to ask the important questions of what Muyibat said. What do you want out of this? What's happening? What are your barriers? Where do you want to be? And helping identify those things. You don't necessarily have to be an expert in this. I don't have to have gone through 7 career transitions myself to help guide a client through a particularly challenging thing. As Muyibat said, medicine has a ton of inertia behind it. I mean, that's a great way to put it. So having somebody behind you that is able to ask the open-ended questions and help guide you, help you guide you essentially through this process, I think is really important. But this is definitely an area when I encounter clients, it's not something I'm an expert in, but it's something that I think through coach training and things, we can work through together.
Right. I have just, even a very recent example where it kind of just made me think of something where, when there is that tremendous amount of inertia, a coach nudges, right? And nudging has that connotation that you're noticing what the client is really wanting to do, and it's not a push or a shove, right? And so, because that's probably more advising, or, you talk to a lot of people that are reaching out for coaching, and they'll say, I talked to 3 of my friends across the country and I'm getting 3 different opinions on what I should do. And you kind of nuance, like, how are they saying it? Well, John or Mary says, you definitely need to do so-and-so. It's like, wow, how do they know that? How do they know what you should do? But as a coach, when you're nudging, it's kind of like in sort of the coaching skills that you learn or the style of doing it, you're kind of inquiring, like, what if you did so-and-so? But it's not like, hey, you should do so-and-so. And sometimes you have to point that out. Like, I'm not saying that you should do this, but like, what would happen if you did that? And you start noticing the person needs just someone to help them make the decision that they've been holding on to for several days or several weeks or several months. And you're helping them have confidence in how well they've thought things out.
To piggyback on what you just said, Jeff, I also think that the second part of that is there's also usually follow-up on that discussion, right? So you're nudging them, you're asking them to think about certain things, or maybe even do certain things. And usually there's a follow-up conversation where you revisit, well, how did that go? Or what are your thoughts now? Or when you had that conversation with so-and-so, what was the result? And I think the difference between coaching and advice is when someone asks me advice, I typically don't ask for feedback. I give it, and you take it or you leave it. And if you didn't take it, why'd you ask in the first place? You have some thought on that. So I just think it's inherently different that coaching has that feedback follow through mechanism kind of built in, because I think this particular topic, yeah, sure, there are clients that are ready to pull the trigger, and one conversation maybe opens the floodgates and things happen. But I think more commonly it's a slow progression of things. Their thoughts evolve over time, and as they take certain actions or talk about certain things, it changes. And so I think that feedback and follow through are really, really important in this space.
Absolutely.
Any other comments on career transition? I know it's really broad. It can mean a lot of different things, again, to each and every one of us. But any other comments from our panelists before we move on?
Just giving tiny examples, like I've coached people that were approaching and transitioning into retirement. I've coached people that were changing their clinical practice in a fairly drastic way, like either changing specialties, changing their practice model, which is actually a pretty big transition. I've even coached someone that was pretty young in their career and was transitioning out of medicine, and that wasn't me directing it. It was just going through the process that particular client needed or wanted.